3.
Hey, this is Dr. Bob and my lovely assistant Shelly and her lovely little dog Jade. He's going to be the star of this video right here. We're going to be talking about anal glands. So we want all of y'all to be anal glandologists. So let's tell you a little bit about anal glands, what they are, what they're for, and what we can do about them, because we see a lot of people bringing in their dogs, and rarely their cats, for anal gland issues. So I'm going to show you what they look like and what are these glands in the first place. So on one side you'll see this is sort of the anatomy back here. The glands are at 4 o'clock in relationship 4 o'clock and 8 o'clock in relationship to the rectum here. And just a bigger overview. And again, this is just to show what an anal gland abscess can look like, but for our purposes, we're just interested in showing you what they look like. They are a gland that is always producing this disgusting material. Why do they have them? Well, this is the exact same gland that a skunk has when you smell a skunk, and when they use a skunk uses their or sprays to try to repel any potential attackers or predators. So it's believed that primitive dogs also use them as a defense mechanism the same way that skunks still do presently. Now, obviously, the sort of the chemical makeup of these glands is not the same as skunks, or Shelly and I would be out of a job, or we'd just be seeing cats. No, cats have them too, but it's not as much of a problem, okay? So anyway, this is what the glands are right here. They are actual glands that are making their own material all the time. And that's important to recognize that, because a lot of people are not really clear, why does this keep on becoming a problem? And that's why, because that's their job, is to keep making that material in order to provide, in the case of skunks, a defense for any potential predators, okay? Now, a couple considerations. So look at the gland, and then here is a little tube that runs from the gland up to the rectum. And this is where one of the problems can occur. So we see more of the problems in small dogs. Why? Very simple. We got the gland here, but we got a really, really small tube. The smaller the dog, the smaller the tube. The easier that tube can get plugged up, okay? Bigger dog, bigger tube, it doesn't get plugged up as well, or as readily, okay? And yes, we do occasionally see this in big dogs, but it's primarily a small dog problem. So, the other consideration, the other reason it could be a problem is because of the texture or the consistency of the material that's being produced. Now, unfortunately, there is no way of being able to alter the consistency or the texture. We see extremes from very liquid to almost like thick clay and everything in between. We see some dogs, it's almost like a cottage cheese. So the thicker it is, you can imagine that really thick material trying to get through that little tube can be a real problem. So that's why, again, it's a more of a problem in small dogs, depending on the consistency. And we don't know what the consistency of the material is going to be until we actually empty the glands, okay? So what are the signs you would look for if you suspect there's a problem? Quite simply, if they're dragging their butt. If you see them, they might be in, maybe in the backyard, on the patio, or out in the grass, or even just in your living room, and they're just, I mean, it looks cute, but just it's a signal that they are uncomfortable, not necessarily painful. They are painful if it does become abscess, but fortunately abscesses are not that common. But it can be uncomfortable, so what they're doing, they're dragging their butt in order to try to relieve or some way, and again, they don't know the process, they're dogs, but they're trying to get that gland emptied in some fashion, okay? Now, also important to recognize, and it's a little bit more better illustrated on this side, these glands are surrounded by what we call sphincter muscles. The sphincter muscles, it's the same in people as in pets. These sphincter muscles push poop out. So when we have a bowel movement, when a dog has a bowel movement, it's the responsibility of those sphincter muscles to squeeze to remove the material, remove the feces, and consequently we defecate. So the glands are actually surrounded by these sphincter muscles. So typically, when dogs have a bowel movement, they will actually squeeze a little bit of those glands and actually be able to relieve or remove a little bit of the material that's being produced by the glands. But again, depending on the consistency, depending on the size of the dog, then they may or may not be able to efficiently be able to kind of evacuate some of the material in there. So if it becomes a problem and we see your dogs dragging their butt, then that's a good indication we need to go in and try to have the glands emptied. Okay. Now, just to let you know that there are certain situations where we do advise having the glands surgically removed, and yes, they can be surgically removed, but that's seldom necessary. But sometimes if a dog has recurring infections of the glands, then yes, it's absolutely recommended. Go ahead and just remove them, problem solved. Okay, so let me go ahead and show you the technique that we're going to use to empty the glands. You need three things. You need a glove, you need a dog, and you need Shelly. Okay, so Shelly is going to be available to come to your house. She'll hold your dog, and the other thing, also important, you want some form of a deodorizer, because again, they can be pretty smelly. Two more things. One, do this outside. Don't do it in your house, because you're sure to have a little bit of a mess on your hands otherwise.
Or in the bathtub.
Yep.
Before bath.
Yeah, but make sure you aim for the corner of the tub area, not out towards like the bathroom area, because yeah, these things can when you're squeezing them, they can actually shoot out a lot of material, and it is pretty disgusting. Okay. All right, so roll up your sleeve if you got long sleeves, much like I'm doing. And this is really crucially important. When I'm going to do the anal glands, actually there's a couple of different ways you can do this. Now, I've been doing this for literally over 40 years now. I've done literally thousands of dogs. I've got enough finger strength that I can actually do, I would say about 95, 98% of the dogs, I can just do it with my fingers. Although some cases I will have to go into the rectum. Now certainly I'm not going to encourage people to do that because most people are A, not comfortable doing that, and B, not really sure what they're feeling for. Now when I do the glands, really crucially important, I've got to get that tail straight up. If I go at an angle like so, I'm not really going to be able to get near as much of exposure to the rectum as I would. But if I get that tail straight up, the rectum is actually going to pop out a little bit. So notice the difference here and notice the difference here. So now I can get exposure to the rectum. Now, when I show one of our clients how to do that, if they want to learn, right now, I mentioned 4 o'clock and 8 o'clock, I can feel those, the glands right here. They feel like soft marbles, and that's what you should expect to feel. They feel like little marbles under the skin, and you just have to make sure you push your fingers up to be able to feel them. So I tell you what, I'm going to get Becky, you want to circle around this way. We're going to get you, because I'm going to circle around this way, and Shelly, I'm going to get you to kind of circle around on the other side. We're going to make sure that Becky doesn't get splattered here. So notice again, I'm going to get that tail straight up, and then I'm going to take my paper towel with my hand with my glove, and I'm going to push my fingers up, and then I'm going to start to squeeze. Okay, and here we go. You see all that material coming out there? Pretty nasty. Yep. As you can see, it starts to jet out, and I just keep on squeezing and squeezing and squeezing. Now, most people are afraid they're going to hurt their dog in some way. If you really pinch hard, yeah, you could. But you see, I would just keep squeezing and squeezing until I've kind of milked all the material out, and then look at all that. That's a lot. That's a lot of stuff coming out of there. Now, of course, the glands are going to continue to make that stuff, and I'm just going to get another squeeze. But again, I'm going to milk it out about 4 or 5 times. Yeah, I even got a little bit more. There we go. And you'll reach a point where you feel like it's pretty emptied, and we're done, and that's it. Okay. So let me get the other important piece of equipment here, and let's get a little deodorant. And this is more for us than it is for Jade, but thank you, Jade. You are awesome. And that's it. So, yes, and then throw this away. Yeah. So use actually one thing I could have showed you, I actually used the glove. I've got the glove on, I've got the paper towel, and I actually just kind of rolled the glove off, so I've actually sort of got the nasty paper towel encased inside the glove that we just used. So that's a good way of trying to remove some of the odor from the environment. So that's it. So hopefully if you feel, sort of, emboldened to try it, again, I promise you can't hurt anything. Yeah, you might get a little bit of a squeeze or a pinch that might be a little bit uncomfortable, but you're not going to hurt anything. You're not going. There's nothing tragically that can go wrong with this. And certainly, it's just like anything else you do. It takes a little practice, a little confidence. But I know anybody can do it. It just takes, again, practice, confidence, practice, confidence. And the more you do it, the more comfortable you'll become. I don't personally recommend doing it on a regular basis. I know a lot of times dogs do go to their groomers and they'll get their anal glands done every 6 weeks. We know when we squeeze these glands, we are going to get a little bit of irritation, inflammation in those glands just from the squeezing action. If I can get away with doing less of the squeezing, great. That's what I want to try to achieve. So the less I try to squeeze those glands, the less that we're going to get inflammation or irritation associated with the glands. So my recommendation, just when they're scooting, okay? But again, most groomers will try to do it. But the other consideration with groomers, some are pretty good at doing it, some are not. And you don't know if they're doing a good job or not. I certainly don't know if they're doing a good job or not either. But just keep that in mind that everybody's techniques and style and sort of comfort level of doing it is going to be different from one individual to another. So, but Jade, you're awesome. That was great. You needed it. You were pretty full. Glad got you up here, and now go out and try it.
She feels better.
All right. Thanks, guys.